welcome back to another episode of the Breast Cancer Physio. I'm your host Jen McKenzie, lymphedema physiotherapist and ESSA accredited exercise physiologist. Good evening or good morning to wherever you are in the world. In this video, I'm going to be educating you on my top 5 tips for helping you to prevent lymphedema. So let's get straight into it. If you enjoy this content and you would like to see more, please give this video a big thumbs up. Subscribe to my channel, guys, which is completely free. And leave a comment in the section below if you have any questions on how you can potentially prevent lymphedema from starting. Okay, so let's get into it. Top tip number 1. L-DEX scores. Now, what does L-DEX mean? What does it stand for? L-DEX stands for Lymphedema Index. So what this involves is a test that you can go and get done if you're nearby to a lymphedema therapist. So that might be a physiotherapist, it might be a nurse, it might be an occupational therapist, but essentially someone with training who has a device which is called an L-DEX device. Now, essentially what this device can do is it can give you a baseline score as to whether or not you have lymphedema in your arm or not. So this is a really important thing to do because it can allow you to be assessed at baseline, meaning that even if you've had lymph nodes removed, you may not have lymphedema at that point in time. And so if you get a baseline L-DEX score done, then hypothetically in the future, if you've started to develop symptoms in your arm that you were suspicious was lymphedema, you can return to that therapist and they can repeat the L-DEX test. And ultimately what this means is that it takes the guesswork out of diagnosing lymphedema by a long way because they can compare your baseline to you with symptoms. So it's apples with apples, and it really allows the therapist to make a much quicker diagnosis. Certainly that's what I've experienced in my clinic over the last 3 years. So I use an L-DEX device called a Sozo, and I literally use that device every single day. The biggest reason I'm putting this as point number 1, guys, is because the earlier you get lymphedema diagnosed, the higher the chance you've got of actually reversing the condition. Now, it doesn't happen in every single circumstance that you can reverse lymphedema, but if you do catch it at your earliest possible point, you have way more chance of potentially reversing it. Okay, so that's top tip number 1. Go and get yourself an L-DEX score. And if you can't find a therapist near you that has one, I would be prepared to travel for it because boy, are they worth it. Top tip number 2 is exercise. Now, there's 2 main points I want to make about exercise when it comes to lymphedema prevention. The first one might be the one you would actually assume to be true more of the time. So the first point is that if you have had a long break, particularly if you've gone through breast cancer treatment and you've had a long break off exercise, one of the best things you can do when it comes to returning to exercise is not to overdo it at the start. Because when you go from absolutely nothing for a few months, or very minimal physical activity for a few months, and then you go, right, I'm going to grab the bull by the horns, I'm going to get fit and strong because I've had breast cancer, but I've popped out the other side, I'm going to do this. It's a better idea not to do 8 days of CrossFit in a row when you've come off 2 months of doing nothing. And on that note, it doesn't mean you're not allowed to do CrossFit. I have plenty of patients who are doing CrossFit after breast cancer. But my point being is that when you return to exercise after a break, if you've had lymph nodes removed and you're at risk of lymphedema, you want to ease yourself into it because going too hard, too fast can be a problem with potentially triggering lymphedema. So you can overtax your lymphatic system by getting back into exercise too quickly. So I'm going to put a link to one of my videos up here, upper body strength exercises after breast cancer. If you want to do exercise, but you're not sure how to start, that's a great video to go and watch because it eases you back into it. Point number 2 I want to make about exercise, guys, is that, and this is sort of the flip side of the first point, is that exercise is actually really preventative towards lymphedema. So as long as you don't go too crazy at the start getting back into it, exercise is one of the best ways you can actually prevent lymphedema. The way the lymphatic system works is that it doesn't have its own mechanical pump behind it. So I've described this in other videos I've done, but I'll go over it again because I think it's a really worthwhile analogy or explanation. If you cut an artery, it will spurt blood because of the pumping mechanism of the heart behind the arterial system. If you cut a lymphatic vessel, it will trickle. So there's no mechanical or no major mechanical pump behind the lymphatic system compared to the arterial system. So the lymphatic system relies heavily on muscle contractions around it to flush it, through. So exercise, of course, involves multiple muscle contractions in one session. So, exercise is a really, really good way for lymphedema prevention. I'll also pop a couple of really good studies in the description bar below. So if you want to go and read the research on how preventative lymphedema can be towards exercise, I will leave those down below. Top tip number 3 is skincare. So skincare is really, really important because if you've had lymph nodes removed, what you really need to understand is the fact that lymph nodes are part of your lymphatic system, which are part of your immune system. So when you've had lymph nodes removed from an armpit, your skin on your affected arm is forever mildly compromised in terms of its immunity. So again, I'm going to leave a link to one of my videos that I've done in the past called Current Prevention Guidelines on Lymphedema, which will go into a little bit more detail about why skincare is really important. The other video I can leave a link to, of course, is a video called Why I Should Moisturize My Arm. So I'll just leave a little card up there for this one as well, guys, because both of those videos go into a lot more detail about why this is so important for lymphedema prevention. But to summarize it, in this video, I want to make the point that one of the biggest things that can help towards lymphedema prevention is a daily task which involves just moisturizing the skin of the arm that has had lymph nodes taken. Because if you can maintain a good skin barrier, then by moisturizing, and that can involve moisturizing from the inside out as well, so make sure you're drinking plenty of water. But if you moisturize from the inside out and the outside in with moisturizer and water, then you're essentially going to maximize the skin integrity of the arm that's affected, and ultimately that means that you've got much less chance of a bug breaking through the skin barrier, particularly if you get a cut or any sort of skin breakdown, which can lead to an infection. Now, the reason an infection is a big deal is because when you've had lymph nodes removed and your immune system is compromised, if you get an infection on the skin of the affected side, you're at much higher risk of cellulitis, which is another potential trigger for lymphedema. So guys, the take-home message with top tip number 3 is look after your skin with moisturizer and hydration. Top tip number 4 is heat load. So why I bring this up is because we've just had one of the hottest, most humid summers on the Sunshine Coast in Australia that I've experienced for a little while. And it was amazing how many women were coming into my clinic with raised L-DEX scores. And honestly, I was starting to believe that for quite a few of these women that it was really only the heat and the humidity that were triggering off some lymphatic responses or early lymphedema. So heat's a really hard thing to control because we can't really control the weather, but you can certainly in a lot of cases control your exposure to that heat. So what I mean by this is maybe avoid going out in the hottest part of the day for really long periods. Say if you want to exercise, and choose to exercise early in the morning or into the evening when the temperature's cooler, and certainly try to cool your body temperature down if you do find yourself getting hot. And that can be really basic stuff like having a cool shower, putting the fan on at home, opening some windows to let some breeze in, putting an air conditioner on. Of course, not everyone has access to air conditioning, but if there's a worthwhile investment when it comes to lymphedema prevention, my goodness, air conditioners are fantastic because cooling your body temperature down is a great way to avoid overtaxing your lymphatic system. Another really good means of cooling your body temperature down, of course, is jumping in a cool swimming pool. So if you've got the ability to do that, that's another really good idea. So yeah, top tip number 4, guys, is just making sure you're not overloading your lymphatic system by particularly accumulated exposure to heat stress. So keep in mind as well, like say if you went to the beach one day of the week and you did happen to get a bit hot, you might want to have a few days off before you're going back again. So making sure that you're not doing 7 days worth of, gardening in the middle of the day and then going to the beach and then going for a walk at midday, all that sort of stuff. So accumulation of heat stress can definitely raise an L-DEX score or trigger early lymphedema. So watch out for the heat. Top tip number 5, guys, is body weight. Now, I'm just going to go into a little bit of detail what I mean by body weight. So, like I said before, there's plenty of patients that I've got that are athletes, that are people returning to CrossFit or heavy gym training after breast cancer treatment. So, when I talk about body weight as a risk for lymphedema, I'm not actually talking specifically about weight. I'm actually talking about fatty tissue, because if you're really fit and you've got a lot of muscle mass on your body, you're going to be pretty heavy on the scales potentially, because muscle is twice as dense as fat. And so you're going to look like you've got a massive BMI if you stand on a set of scales and do the maths. So what I'm alluding to here is that if you've got increased fatty tissue on your body, you are at higher risk of lymphedema if you've had lymph nodes removed after breast cancer treatment. So if you're overweight or obese, so if you know you've got excess fatty tissue on your body, then what I would recommend is you definitely focus on getting to a dietitian, getting on a weight loss program that's essentially going to target loss of fatty tissue, because that is one of the best preventative ways you can stop lymphedema arriving. So when I talk about weight loss programs, I'm specifically talking here about diet, because certainly from all the research that I'm aware of, there's way more impact by dietary changes on fatty tissue than there is when you exercise on fatty tissue. So exercise can assist with weight loss to a degree, but if you really want to lose weight, meaning fatty tissue, not muscle or fluid, then the best way forward really is to speak to someone who can educate you on a healthy way of eating. Yes, a lot of people don't like the word diet, but essentially we're talking about a healthy way of eating that can target fatty tissue loss. Now, I also really want to make the point here that slim women can still have too much fatty tissue. So there's plenty of women that walk into my clinic and they might look pretty good, but then we put them on our body composition machine. So this is better than a set of scales for assessing fatty tissue, and I'll talk about that in a second. But we've got body composition analysis machines at our clinic, and what these machines will do is within 30 seconds, it will be able to tell you how much muscle mass, how much fatty tissue, and how much fluid you're made up of. And that's important. It's really important, because someone who looks slim can still actually have too high a percentage body fat, and they can be at higher risk of lymphedema than someone who might look overweight but it's actually got a fair bit of good muscle mass on them. And yes, they might have a bit of fatty tissue there, but they're not excessively high in their fatty tissue component. So all of you slim ladies out there, make sure you go and get your body composition analysis tested if you've had breast cancer treatment, if you've had lymph nodes removed, meaning you're at risk of lymphedema. So ultimately, the take-home message here, guys, is that fatty tissue and lymphedema a little bit go hand in hand risk-wise. So the higher the body fat percentage, the higher the risk of lymphedema. So get yourselves down to your local dietitian, get yourself on a body comp analysis machine, and definitely don't use your scale. So this is what the point I was alluding to a second ago. A scale machine, so to speak, or standing on a set of scales, is not going to be able to tell you if you're overweight or underweight or normal, because the scales just produce a number. It doesn't break down fatty tissue, muscle mass, bone stock even, or fluid. So scales I never ever use to make an assessment on whether someone is healthy or not, or whether someone's got a risk of lymphedema or not. So yeah, get yourself assessed with body composition analysis. Thank you so much for watching this video, guys. I really hope you've enjoyed this content. If you have any questions about how to help prevent lymphedema, then please leave a comment in the section below. Give this video a big thumbs up and subscribe to my channel, which is completely free, and it really helps me out to make more free videos for everyone out there. I'm Jen McKenzie, the breast cancer physio. I'll see you here back again next Tuesday for my next video. Hope you're having a great week. I'm Jen McKenzie, the breast cancer physio. I'll see you next time.